Hi, Reagan Gibson here. Today we're going to be doing the wound care checkoff video. So first I'm going to start with my safety practices. So I'm going to check the orders and I'm going to check the patient's allergies. I'm going to assess the patient and assemble all of my supplies. I am going to wash my hands and don my gloves. I'm going to identify myself and identify the patient using two identifiers. I'm going to provide for privacy, and then I'm going to educate, explain, and evaluate. So if the patient needed pain medication, I would make sure that I gave it 30 minutes before we started the dressing change. So I'm going to put on a clean pair of gloves. And when I'm removing the dressing, I'm going to apply a little bit of tension to the skin to avoid any kind of tearing. I'm going to make sure that I remove it away from the patient's face, and that way they don't see it and get queasy. I'm going to remove the packing. And I'm going to assess the dressing and the wound for what kind of drainage it is, whether it's serosanguineous, purulent, any kind of odor. And I'm also going to be checking for granulation tissue, which is the kind of tissue that you want to see. It means that the wound is healing. So after I've done that, I'm going to remove my gloves and discard. Then I'm going to put on a clean pair of gloves. And now I'm going to be measuring the wound. So I'm going to do length and width first. I'm going to make sure I use the same form of measurement for both sides, whether that's centimeters or inches. I'm going to make sure that I'm not touching the wound to avoid any kind of contamination. So I'm going to do length and then width. And then next, I'm going to be checking the depth. So I'm going to take my Q-tip applicator, and I'm just going to be poking around in the wound, checking for the deepest point, and once I found it, I'm going to slide my fingers all the way down the applicator until they're level with the wound bed, and then I'm going to remove it, hold it back up to my measurement device with the same form of measurements that we did the length and width. And then I'm also going to be checking for tunneling and undermining. So same, just going to kind of feel around with my Q-tip applicator, find the deepest point. Once I found it, slide my fingertips down, hold it up to the measurement device. So once I'm finished with that, I'm going to discard. So before I open my sterile dressing, I'm going to go ahead and get my tape ready. That way I don't have to reach outside the sterile field to get it afterwards. I'm just going to be measuring to see how much I'm going to need to cover the ABD pad. I'm just going to get 2 pieces for this wound because it's a bit of a smaller wound. And then I'm also going to get a 3rd piece, and that's the piece that I'm going to write my initials, the date, and the time on to place on top of the dressing. So when I open up my dressing tray, I'm going to make sure that I keep my arms between my waist and my shoulders. I'm going to make sure I'm not reaching outside of the sterile field or any kind of contamination. I'm only going to touch the 1-inch border on the outer edge of the dressing tray. So for my solution, I'm going to be checking the expiration date, just making sure I have the right kinds and things like that. I'm going to open it, come around the sterile field, pour it over my gauze, and come back around. And then for my dry gauze, I'm going to open it away, come around, and dump it, and discard. Now I'm going to don my sterile gloving. So once again, my 1-inch border. So I'm going to start with my dominant hand, which is going to be my right hand. So I'm going to pinch this inside of the cuff. I'm going to slide my hand inside. And then I'm going to reach the inside of this cuff right here. So typically we would use the iodine swabs, but there aren't any in my kit, so I'm just going to be using gauze in this video. So I'm going to make sure that I'm taking a new piece of gauze for each swipe. We're not going to reuse the same piece. So we're going to go outer, outer, and inner. And then I'm going to take a wet piece of gauze, and I'm going to fluff it, and I'm going to take my Q-tip applicator, and this is where I'm going to be applying the new packing to the wound. So I'm just going to apply a little bit of pressure to get the gauze in there, but I'm going to be as gentle as possible to avoid causing the patient any kind of pain. And I'm going to make sure I keep my packing level with the wound bed. And once that's done, I'm going to take 2 pieces of dry gauze, I'm going to lay it on top of the packing, take my new ABD pad, and my tape. And then the piece that had my initials, the date and the time. So once I'm done, I'm just going to report and record any abnormal findings and how the patient tolerated the procedure.